We're getting Daxxify today, and we'll learn a little bit more about the difference between Daxxify and other injectables.
The first thing we're going to do on any type of Botox is to mark a patient off. And we want to improve the 11s. And so do a little frown for, I want to accentuate them. So the muscles we want to hit for that are right here, and right here, and right here. And we're going to soften those muscles. And what that's going to do is going to do this, but it's also going to lift up her brow a little bit to give her a little bit more youthful look. And then she's going to get a little bit across here too to help those lines, a tiny little bit down here, okay? And she also has the problem with TMJ, so we're going to soften her masseter muscles to take some of the pressure off her jaw joint. So bite down, I want to feel where that is. Yeah, you got a pretty prominent muscle there, okay? That also, it softens that muscle and also reduces the volume here, and some people really like that to have it slightly. So accomplishes two things back there. It softens the pressure on the temporomandibular joint, but it also brings this part of the face in. What we're doing today is we're going to do Daxxify. Daxxify is the newest of all the Botox agents. It came out earlier this year. It got an FDA approval, and the big advantage of Daxxify is it lasts about twice as long. Normal Botox lasts between 3 and 4 months. The Daxxify lasts between 6 and 8 months.
Okay.
So,
what would you say to someone that's considering injectables, but maybe a little nervous or apprehensive?
I would start to someone who has experience in doing this, and I would start off slow. I would start off with, don't go crazy your first time. I would start off possibly with just a little bit of Botox, maybe a little bit of filler either in your lips or your cheeks or somewhere else on your face where it needs volume. But again, don't overdo it the first time.
What are you seeing age-wise? When are most men and women starting Botox?
I mean, there's quite a range. We're seeing it anywhere from, people in their late 20s, early 30s that don't want, more of as a preventative thing. So the range is really, 30 to 85. Mm-hmm. I think a lot of the people we're seeing start like probably late 30s, early 40s when they first start seeing creases and wrinkles and loss of volume either in their cheeks or their lips. Do a little frown for them. Let's see okay, now relax. I just want to identify that muscle. Again, you want to inject it right into the muscle. Now she received about 25 units of the Daxxify right there, okay? And I'm going to give her another. It's a pretty low dose. I believe sometimes less is more, and it's rather than overdoing someone, I'd rather have them come back and do a touch-up. So now her muscle is really strong. We're going to give her a couple injections into that muscle. So, and this is to soften that masseter muscle. Squeeze down, like that. It's like a hard walnut on her. Mm-hmm. Will help the inflammation in her jaw joint from either grinding or clenching, which is a very common cause of ear pain and ear pressure, even dizziness. And it will also reduce the volume, giving her a thinner jawline, which a lot of people do like. Okay. All right.
So for people that haven't gotten injections, anything post?
Well, usually, most Botoxes take anywhere from 2 to 4 days to sort of kick in to see the initial effect. You don't have to do a lot during that time period. Just sort of let it happen. Some people do massaging. I don't believe that really has any use. The maximum effect is about 10 days. And usually if it's the first time we've done it to someone, we see them back at 10 days to see if they don't need a little bit of adjustment. So, and usually we have you ice the first day 2 or 3 times after we inject. For the fillers, you tend to get a little bit more swelling. We use different fillers. We do use Radiesse and all kinds of different products on the cheeks. Radiesse is a calcium hydroxyapatite. It is injected right on the bone to give volume of the cheeks. And there's a whole host of what we call hyaluronic acid products. Those are products that it's a naturally occurring substance in the body.
and Juvederm and Restylane are in that category. There's also another one called RHA, and they give volume to the lips and to the soft tissues, also to the cheeks, but anywhere where we want to improve the volume of the skin, okay, and the bone structure. It can also be done to enhance the chin, to decrease depressions in here. The two most common areas I use it on are lip enhancement. Again, I like it subtle. I don't want to have a big, really obvious, massive lip look. I wanted a natural look, and same with the cheekbones. So these should be subtle, natural adjustments.
What about working out after you get?
Usually like the next day, okay? But even if you did some soft exercise the first day, it's not going to hurt it. Okay.
Anything else for our spicy indigos that are considering?
No, just start off. Go to someone who has experience. The products are very safe, and especially the first time, don't overdo it. Minimize it, and then if you want more, you can always do more. It's hard to subtract.